Welcome to the first in a series of podcasts that Ahead is launching, focused on modernization and leveraging technology to meet new and expanding needs in healthcare. Today, I'm joined by Houdini Abtahi, one of Ahead's client service partners, and Houdini also co-leads the healthcare vertical community. We're joined by John, Field CTO at Oracle, and Esteban Rubens, a healthcare field CTO for Oracle Cloud. Today, we're going to discuss something that's really kind of top of mind for a lot of healthcare companies, clients, systems. We're focusing on discussing resiliency in healthcare and how do hospitals and providers prepare for shocks and disruptions so they can recover as quickly as possible. And how can they adapt by learning lessons from us and from others and from what's happened to them so that they can really leverage that to perform better and be more prepared. So with that, let's jump into the discussion. I had a question, maybe Esteban, I can point this at you. Based on your experience, why is resiliency in healthcare critical? What are the consequences of lack of resiliency and a resiliency planning, say on like tier one clinical apps?
Yeah, thank you, Jay, and thanks for having us today. Obviously, this information is crucial for patient care, has to be available all the time. Zero RPO, zero RTO is really the ideal state. Not everybody can afford that because obviously, as we know, you can get to any state that you want, but you have to plan for it appropriately. You have to have the right machinery behind it. You have to have the right procedures in place as well so that you can leverage the planning that you undertook in order to avoid the impacts, right? The impacts are what we worry about the most, the impacts on the clinical side and the financial side. And both are important because obviously everything is about patient care. So the clinical side, having the right information at the right time in the right place to treat the right patient is crucial because as we've all seen in the news, this is not just in the healthcare news. This is international news where hospitals are now fully automated and they're fully digitized, even though maybe, yes, digital transformation still has a long way to go. But EHR, right, in North America and Western Europe, in a lot of the world, everything is in terms of the patient record is digitized. So when those systems are not available, you have to revert to paper charting. If you don't have the proper planning, it's a disaster because not only does it impact in terms of time, but as we've all heard, what used to be the triple aim that then became the quadruple aim, the quintuple aim, staff burnout, whatever you want to call it, right? The mental health of clinicians is very important. They're already stretched thin. So if all of a sudden you have the situation in which the systems are not available, you have to revert to paper charting, that adds exponentially to their woes, right? So it's not a good situation. And in the US, for sure, other parts of the world too, maybe not so much, providers operate on razor thin margins. We know that. So anything that upsets that balance can have devastating consequences. And we know, so I found a bunch of reports. For instance, one talks about some hospitals are just one incident away from closing. And we've seen this, hospitals that are unable to be resilient, they get, whether it's ransomware or natural disaster, whatever that is, they cannot recover. So this is really an existential threat. This is not just, we should plan for this because it makes sense and it's good IT policy. This is about life or death of patients, of clinicians, and of the institutions themselves. So we really should take this very, very seriously. And then even when you talk about reverting to paper charting, some of these risks have been quantified. I found this paper in the National Library of Medicine that talks about during downtime where you don't have your normal systems, they're looking at lab results. Specifically, they were delayed by an average of 62% compared to normal operations. So that's just one random data point, but this is part of a pattern. So why is resiliency important? Well, because again, just to recap, lives of patients, lives of clinicians, and lives of institutions really, really depend on this.
Great point, Esteban. It makes me think about what happened recently during COVID and the fact that we have a lot of things that are probably lessons learned given our experience with COVID, and they all tie to, how resilient the systems we had in place were. Can you talk maybe a little bit about some of the lessons learned in your experience, things that we think, or should be important given some of the things that you saw during COVID?
Yeah, absolutely. And I would say the one word that encapsulates this is agility. You have to be able to be very nimble, very agile, because we saw that everybody all of a sudden had to work from home, and the IT consequences of that were major. How do you do this quickly? Well, this is what cloud excels at, right? You're able to be very elastic very quickly. And on top of this, not only the ability to be elastic and nimble, but we saw that the pandemic also caused all sorts of problems with supply chain, right? So people were not able to get things. So even if, say, somebody wanted to buy a couple thousand laptops, they were not able to. Those were just not available. They couldn't buy servers, they couldn't buy storage, they couldn't buy networking gear. So it's about knowing what you're going to do if what you think you're going to, maybe your preferred route of action is unavailable. So you have to know. It was very interesting because the pandemic, at least the early 2020 version of the pandemic, was a forcing function because, yes, gear was not available. So we had to do something. So we went to virtual desktops, right? And the cloud sort of came like a knight in shining armor because it was the only way that most institutions were able to accommodate the very, very quick transition to work from home. And as we know, maybe a lot of institutions had plans for that to happen, but they were, again, forced to implement them in no time because there was no opportunity to have committees and talk about things and go over. It's like people were home and they had to work. And so you had to be able to do this. So knowing what resources are available and knowing what the state of technology is extremely important, as well as being aware of what you can leverage, right? So maybe before the pandemic, provider institutions were not thinking about GPU compute that much. Well, it turns out that for virtual desktops, it's exceedingly useful and it made all the difference in the world. So it's having those I's dotted and those T's crossed that will enable you to be even better if it or when it happens next time. And not to mention anything about telehealth, right? Same thing. We had been dabbling in telehealth for a very, very long time, and bureaucracy and this or that, like, it wasn't happening. And all of a sudden, it was the only way, right? It just happened. And you had to have the right infrastructure, you had to have the right pieces kind of lined up. And one of the things I love about working for Oracle was that, for instance, if you take our customer Zoom, right? They were able to massively scale up during the pandemic. We all know that Zooming became a verb, right? It was that important. And having this incredibly large infrastructure that allowed that scale to happen very quickly is mandatory, right? So we have to learn from that. And really remember, because whether it's a pandemic or something else, there will be other disruptions. It's impossible that there won't be. So thinking about what happens if there is all of a sudden a need to spike, have an extreme spike in IT resources, whatever shape or color they may be. So you have to have a plan to know what you're going to do if that happens again. Because I think at this point, no one ever again can feign ignorance. No one can say, yeah, we didn't know this could happen. Yeah, it could happen.
Yeah, I think one thing that you made me think about, Esteban, is we've changed how we look at the closeness of our provider in terms of providing service. And that's one thing that I think the pandemic did. Everybody's used technology, given kind of everybody being remote, to receive medical treatment, via telehealth. So we're almost spoiled now, right? The expectation is that's part of my experience with my provider. And if my provider isn't providing that degree of ubiquity, right, so that I can almost access anything from anywhere, you're not really providing a great customer experience. And that, I think it's almost like we got spoiled because of that.
Well, yeah, it's like Schrodinger's cat, right? So the box is open. The cat is alive. We've seen that already. So there's no going back. You can't undo that.
Right. And I mean, some of the things too, I mean, some of the other kind of points about the ubiquity, access to information, and how we track things like tests, and especially, given, vaccination and vaccination tests was, everybody's looking at that during COVID. So I think standing up that type of capability, using that ubiquity, talk about cloud to enable that. I think some of those things, to your point, may be becoming more of a expectation than a nice to have. I don't know.
Oh, absolutely. And sorry, just one other point. If you look at that specifically, and thanks for bringing that up. Anybody listening to this who may have received a vaccine, especially in the U.S., you probably got text messages from VSafe, right, to asking you to report on, do you have any symptoms, and following up every week, every month, every 6 months. Well, not only was that developed on Oracle sort of low-code tools on OCI, but also it allowed for kind of a whole new kind of epidemiological research, because we were able to collect so much data so quickly. It just, again, it's about this agility and nimbleness, stand this up in no time at all and scale it up to hundreds of millions of users and billions of check-ins. And all of a sudden you have this massive amount of clinical data that you can do something with, right? So instead of having to kind of painstakingly plan the clinical trial, you had all this data, so you could do a lot of things that were not able to happen before. So check for the efficacy and safety of vaccines in different kinds of groups that maybe were not studied well before. So whether the most salient example of that is, pregnant women, that became kind of the shining example of how useful it is to stand this up very quickly, to get all this data and to be able to use it to affect clinical care, at the population level. So yes, absolutely. And it has to do with resiliency as well.
That's great. Houdini, you and I've talked a little bit about some of this. I think we need to get a little back to basics with some of it, though, because sometimes we throw around terms, and I don't know if we completely understand what they mean, but I don't know. Did you have a question you wanted to pepper in here?
Yeah, for sure. And thanks, Esteban, for that background. Because it does, I think we all would agree, since COVID began in 2020, things have changed dramatically. And a question I had for John actually was around resiliency. And I think, we think of resiliency pre-COVID and post-COVID. And just kind of break it down to simplistic terms for our audience, John. I mean, when you think about resiliency now and what you're hearing from your clients, what does that kind of mean to you?
Yeah, thanks, Houdini, for this opportunity. And resiliency is the hot topic within the healthcare customers. We've been talking to a number of them, and resiliency constantly coming up, particularly after we went through this pandemic. It's a bit different before the pandemic, and I'll walk you guys through a little bit. But let's go to the basics first, like Jay's talking about. Let's define what is resiliency. So this is how I will say it. Kind of a resiliency, I'm going to define it because Esteban defined it in terms of the business, healthcare business side. I am going to define it in terms of the healthcare systems that supports the business. So I would say resiliency refers to the system's ability to continue operating. That's the key word, continue to operating despite the failure of any one of the system component failure or suboptimal performance of some of its components. So if you double click that resiliency, I will put it into these 4 buckets. The first one is the availability. Second one is the reliability. And third one is kind of the main thing. We need to do that, but still it needs to be secure, because security in healthcare is absolutely critical, and that needs to be part of the resiliency bucket. And then the last one is performance. So let me get into what is availability. So if you look into availability, it's the proposition of time your system is functional and working. Let's say if you want to design a high availability, you need to consider 3 key elements. What is that? The first one is the redundancy means that multiple components can perform the same task. So the problem of single point of failure is eliminated. That's the first design thought process you have to have. Second one is you need to constantly monitor the health of your systems, because I always say if you don't monitor it, you can't manage it. So you need to constantly monitor it. And then the last one is kind of the have a failover process in place so that if something happened, because you have to design for the failure, it's going to happen. So you have to kind of have a failure process in place and then make sure you are testing that one. So that's how I define it. If you get into like a recoverability, people ask, okay, define that one, John. How do you guys see it in the healthcare customer when people talk about recoverability? I always say recoverability is the ability of a system to recover from failures and continue to function with the minimal downtime and data loss before full recovery. That's the key point, because we know in the healthcare, Esteban talked about whether it is a patient-centric applications or clinician-specific application, the system availability failure, even failure happens, the system should continue to operate. And we know, healthcare companies increasingly rely on cloud computing nowadays and digital transformation and digital infrastructure to operate and deliver value-based care. It's critical to understand the significance of cloud resiliency and its advantages to the healthcare customers. So I would say a well-implemented cloud resiliency architecture provides the things we talked about, the reliability, the availability, and security and performance by default. So the healthcare companies can leverage these default resiliency capabilities available by this cloud service provider to make their applications resilient. One thing I would also talk about, Esteban talk about cyber attack. That's absolutely critical nowadays. So the cloud resiliency should able to handle the cyber attacks, and it should minimize, it should avoid, it should prevent that one. And another thing I would talk about is kind of automatically detect and respond to disruptions, because that's the main thing. This is where the automation come into picture. Rather than human intervention, the system should automatically detect and also take care of the resolution of the failures by default. The good news is healthcare customer don't need to figure these things, how to implement a cloud resiliency. What they can depend upon is the cloud service providers to give them these required resiliency capabilities so that they can infuse those capabilities into their applications to bring those applications resilient to support their healthcare customers. That's probably how I would define it.
Thanks, John. No, that's great. And it kind of leads me into my next question. This one's for you, Esteban. If you think about resiliency in healthcare and IT infrastructure, John gave us a good overview on what resiliency really means at its core. But what I've seen here at Ahead, and I'm sure you guys see at Oracle, is that the healthcare industry is usually laggards in a lot of different areas, and financial services usually is the one that's leading the charge as far as being more agile and able to adapt to things better. Esteban, what do you feel like resiliency looks like in healthcare and that healthcare IT infrastructure today?
I certainly agree about the nature of healthcare IT. There are some reasons for it. Obviously, not great to be laggards, but when you're dealing with healthcare data, maybe there is some reason for it. But be that as it may, it is, I think, actually true that we see that. I would start with the data. I'd like to think about the data first and the systems second. The systems are important, but you have to have ubiquity of access for data. Data has to be available all the time, regardless of what kind of data it is, whether we're talking about structured data in the EHR or even unstructured data, clinical notes, hugely important, images, structured lab reports, and on and on and on. So the data has to be available in some shape. We can see that in the EHR where you have maybe different access methods, or in imaging where maybe you have specialized tools for radiologists and cardiologists, but maybe with VNAs, you have universal viewers that everybody can use to see different kinds of images. So that ubiquity of access is, I think, number one in terms of resiliency. And certainly not only because it's important for patient care, but because this data is regulated. So the penalties for not being able to produce this data, if required from a patient, but not only from a patient, but also sort of legally, are significant. And now that we're in this kind of peak AI time, it turns out that it's incredibly important to have all data. All data used to be a liability, I think. And now more and more we see that all data is a treasure trove, right? Because we're talking about training models with all data that is valuable, because the more data we have, the better it is. And also when we talk about equity, if we think about equity, we know that if a model doesn't get enough diverse data, it will not be good in general, right? And also we hear a lot about AI models being brittle. So if the population from which the training data is extracted is too homogeneous, the model will kind of spectacularly fail if it's taken to a different population. So I think that plays into resiliency as well. And then more maybe mundane things like disaster recovery and business continuance. This is really not about the data itself, but the systems. How are you going to fail over, right? What's your RPO? What's your RTO? Well, your RPO really should be zero. You can't lose any data. Your RTO, well, if you can't do zero, can you do 1 minute? If you can't get back in a minute, how do you do this? And then different kinds of disaster recovery. Is one thing is your data center gets flooded or something like that, or there's a fire, and a very different thing is if you get hit with ransomware. So the end result is going to be the same, and the goals are going to be the same, but it's going to look totally different, right? Because you have to be able to recover from one or another, or maybe a third different kind of problem, and that is an integral part of resiliency. And especially, when we talk about the large provider organizations, they're more sophisticated for sure. But, in the US, we have 5,500 or 6,000, who knows, thousands of hospitals or provider organizations. And a lot of them don't have I wouldn't say sophistication, but just the tools and the financial resources that are necessary for the kind of resiliency that we're talking about here. So, we've all seen this. Customers maybe have what they call a server room instead of a secondary data center, and the server room is in the physician office building that's across the road, and it's not really meant for, it's not a real data center, and it's expensive to maintain, and the business continuance or failover runbook, it doesn't get really used much, or they don't practice because a failover is disruptive, and on and on and on. So I think that's where IT companies that are really steeped in technology, like Oracle, or sort of technology companies, can bring a lot of really useful experience, because as we hear often from healthcare customers, and I think this is not something that we say as vendors, I think this really happens, that they're not in the business of running data centers. And more, I think this is a realization that is hitting a lot of boards, where they're saying, we need to go back and focus on our core competency, and that, we need IT people, but maybe we should be running our own data centers, especially if we're small, right? Because other people can do it at scale better, certainly more secure, and on and on. And so that, I think, is part and parcel of thinking about resiliency in healthcare. And then think about cybersecurity, right? That has to be core to any kind of discussion of resiliency in healthcare, because as we know, the data point that is thrown around all the time is healthcare data is 10x more valuable than financial data in kind of the underground, right? And there's a reason for that. We don't need to get into it, but it is true, I think, that worldwide healthcare organizations, not only providers, but payers as well, and pharma companies, anybody involved in healthcare, they are very juicy targets for cyber criminals. Again, I'm not saying anything new here, right? But it's not if, but when you get attacked or successfully breached. So you have to have the whole layers of defense, cheddar, cheese, whatever you want to call it. But then you have to, beyond that planning and defense kind of layers, you have to know what's going to happen if those don't work. So that is, I think, a big part of resiliency. And we all seen the news, the organizations that were down for weeks, and the patients losing their lives, and the hospitals having to shut down. I mean, any cursory search online will yield thousands of these stories, because very unfortunately they happen. So we have to think about this very deeply and with great care, not from just the vendor community, but from the provider community. Because even though, I'll end here, we all know this, we all talk about this, but there's maybe a certain tiredness that has set in where yes, everybody knows it's important, but it's like, oh, we still don't protect ourselves because this still keeps happening all the time. So I think somehow we collectively need to jolt the system so that we actually we don't just pay lip service to the importance of this, but we actually do something about it, because there is really no time to waste in terms of resiliency.
Yeah, it's great points, Esteban. I think, I've done a lot in financial services too. And in financial services, you're right. They're all about resiliency because time is money. But I think with healthcare, if you really think about running healthcare like a business and kind of the board's perspective, where patient experience is king, and just like in finance, patients aren't necessarily loyal all the time, resiliency really counts. And if you have kind of the forethought and funding, because that's the other thing, have you actually had the forethought to fund the things you need to fund to ensure there's resiliency, that's going to really make a difference in kind of the patients deciding to go to this hospital provider over another.
Retention, for sure.
Absolutely.
Yeah.
So, John, I had one kind of final question for you. I don't know if Houdini might have one or two others, but you guys are from Oracle, obviously, and I know that there are solutions, particularly on the cloud infrastructure side, that from your perspective might be kind of requirements or things that Oracle could suggest having in place to ensure a degree of resiliency for healthcare companies. What's your perspective on that?
Yeah, no, perfect, Jay. Let me talk about maybe a couple of things. So the first area, I put it into two buckets, if you will. The first one is some kind of the actual technology services itself you need to have. And then the second one is also some kind of a best practices, because some of this resiliency you won't be able to address just with the services or products. You also have to have some best practices. So what Oracle brings to the table to the healthcare customers are both these factors. Brings a proven advanced cloud services, specifically deliver some unique capabilities in the resiliency. And then the other one is some of the proven best practices, last 40 years, delivering this kind of enterprise systems to the enterprise customers. We have learned and adapted and documented a lot of best practices. So let me talk about those two areas real quick here. On the advanced technologies, the first area I would focus on is the automatic redundancy and failover mechanisms. Esteban talked about it, Jay, you talked about it. That's absolutely critical because failure is given. But then if failure happens, how I am going to recover? That's what we are talking here. And Oracle Cloud offers different availability scopes for applications and offers to deploy healthcare mission-critical application resources across what we call a multiple fault domains within a data center, within an availability domain. Within your data, within a single data center, you have fault-isolated fault domains. So even if one of your fault domain goes down, your application continue to run on the other two fault domains. Similarly, this way you get your local data center resiliency. And then another one is Oracle also provides multiple regions, multiple data centers within a region. So that gives you kind of what we call resiliency across region, geographical distribution. And then the next one, Esteban talked about this disaster recovery and business continuity. That's absolutely critical. So what OCA offers is the range of disaster recovery solutions to help care customers to minimize the impact of the disruptive events on the business operations. So OCA, Oracle Cloud Infrastructure, supports active-active pattern, active-passive pattern, pilot light, we call it, pattern, and then backup option to healthcare customers to improve the resiliency at the same time, manage the cost, reduce the cost. Because you have to look at this resiliency solutions. Yeah, they're great when it comes to the architecture, but does it make sense on the business side, on the cost side? So that's what Oracle gives the choice to the healthcare customers to pick the right pattern for the need that you have at hand. And then we talked about scalability, like automatically, like Esteban talked about during the COVID vaccine. Boom, all of a sudden people are hitting the system left and right. You have to automatically scale to accommodate the volume. So Oracle Cloud provides auto scaling capabilities. And then security controls and enforcement points, absolutely critical part of the resiliency. And Oracle Cloud Infrastructure adapts security first design. It's not an option, it's kind of a default within the cloud. So it gives you isolated network virtualization. It kind of give you the pristine physical host deployment. So there is no noisy neighbor concept. There is no other tenant co-locating it, things that nature. And also allow the customers to choose the geographic region where their data will be stored. Sometimes we all know healthcare data is there are some regulations. So Oracle Cloud gives you an option. If you want to run your cloud, bring the cloud to your data center, Oracle Cloud offers that. It's called dedicated region, gives the same set of cloud deployment models, same set of cloud services, same cloud economic model in your data center to address your data privacy and regulations requirements. On the best practices side, I would talk about kind of a maximum availability architecture is what we provide to healthcare customers. This is nothing but a set of best practices developed by Oracle engineers over the last 40 years for the integrated use of high availability, data protection, and data disaster recovery technologies. And it consists of set of best practices blueprint for the integrated use of these technologies to ensure the highest level of resiliency for the mission critical healthcare applications. Probably last one, I just touch on the one customer example, Adventist Health. They've been on Oracle Cloud for a number of years. And then if you ask them, they were able to, by moving to the Oracle Cloud, they were able to cut their budget timeline in half, reducing their planning cycle from 6 months to 3 months. It gives them the opportunity to take a look at their clinical data, all kind of details about the services they provide to their patients, kind of bring all the data together to look into it. At the same time, bring the resiliency of their systems to significantly higher level. That's how I will wrap it up, Jay.
That's great. Thanks, John. That's some great insights about some of the things that Oracle can provide. Thank you to Esteban. I think this was a great conversation and provided hopefully a lot of good, solid information about resiliency and where we are within healthcare. And for our listeners, look forward to more trends and insights from us on technology and healthcare with folks like John and Esteban from Oracle and others. We'll be discussing interesting topics like AI and ChatGPT in healthcare, debating the possibility of untethered, almost invisible hospitals, as well as talking about things like can we rate how good patient experiences are within healthcare. So stay tuned for some of those conversations. Again, thank you, John and Esteban. Great conversation.
Thank you, Jay.
Thanks, Jay.